Hi everyone, my name is Dr. Joshi. I am an OBGYN by profession and I also perform robotic surgeries. For the past 10 years, I have worked as an assistant clinical professor at McGee UPMC, and I have recently transitioned into private practice. I am a new grad of the Executive Healthcare MBA program from University of Pittsburgh, and I had received several messages by several physicians to do a little talk, or at least to get us so that they could get more information on what a healthcare MBA program looks like. So instead of sending back messages to each and every one of them, which ideally I should, but just there's due to lack of time, I decided to make this video because I'm pretty sure there's a lot of physicians out there who, or even healthcare professionals out there, who would be interested in getting some more information on these programs. So I just finished my talk on the female physician group, the South Asian women physicians of North America, and of course, I knew that that information cannot go outside the group, so I decided to make this hopefully smaller video so that everyone can review this information outside of the group. So if anyone missed that talk, please feel free to access this one, and I'll post a link about it on Sapna as well. So without much further ado, what is Healthcare MBA? So it is a master's degree that is designed for healthcare professionals who need a strong business background for a management career. It integrates the best of business and healthcare academics in order to help the student excel in healthcare administration. Basically, if you're interested in business administration, that's the degree for you. Why did I want to do it? As a physician in a big facility, I was always faced with this challenge, and I was noticing this and seeing this on a daily basis. And due to no fault of anyone, I realized that there was a huge communication gap going on between physicians and administrators. A long time ago, physicians decided they did not want to handle the administrative aspects of medicine. It was getting more and more difficult to do so. And they decided to hand it over to business administratives. What we realized is we speak completely two different languages here. We as physicians or as medical personnel think that we're in the trenches, we have the first-hand information, we know what we're talking about because we're doing this on a daily basis. This is what we do. And why are they not listening to us? And the administrators, on the other hand, they're looking at policies, they're looking at numbers, they're trying to run the engine, so to say. And they are right in their own aspect because they're saying, well, why are these physicians not listening to us? They don't know how to run the business. They told us to run the business, and why aren't they understanding what we're trying to say? So looked like there was a big communication gap going on, and definitely you needed a link, a common link. So I like to call that the Rosetta Stone, per se, the MBA program, because it helps you use language and tools, or helps you even understand those in such a way that both parties can, communicate with each other or understand each other. And ultimately, the goal is to improve outcomes, right, in the best possible way, where everyone wins and no one feels like they don't want to talk to each other. So that was the whole thought process behind the MBA program. For physicians or for medical personnel. So that's where the healthcare MBA came into being. I was asked what are the different business administration options out there. There's a lot of M's involved, and which one do you pick and why? So the first one is, of course, MBA, the Masters of Business Administration. Second one is MPH, Masters in Public Health. MHA, I told you it gets confusing. Masters in Hospital Administration. and MMM. Now, this is actually a little bit closer to the MBA program, Masters in Medical Management, and it by itself is very good. Unfortunately, that's not the program I chose, so we can try and get someone else to talk to you about the MMM program in more detail. But basically, you know, MBA means business administration. MPH is for public health. MHA is for it's more specific. It is mainly for hospital administration. MBA is more broad, and MMM is medical management. And it is geared for physicians for hospital administration, whereas MHA is Masters in Hospital Administrations for physicians and non-physicians. If that makes any difference. If that helps you understand. The MMM is the closest one to the MBA program out of these, and it focuses on medical management. So this, if you're looking into going into an MMM program, you might want to be a little bit more specific about your goals, saying, I think I want to do a leadership role in a hospital. And then you may not even need to look at the MBA program per se. You might stick to this one. It's a little bit more detailed and geared towards that. So if you're looking for leadership mentorship roles for physicians, that's something you should be focusing on. This is cohort-based learning, and you will see that it helps you communicate better, connect better with your peers. So why MBA then? Definitely, if your whole sole aim in life is not to be a hospital administrator, if you want to, look into other avenues, or if you want to test the waters per se outside of the field of a hospital, then certainly, or if you want to keep your options open, MBA is the way to go. It is geared for physicians and non-physicians. It does give you a broader view. It does cater to a wider cohort because these are, people coming in from different aspects of life, and that actually enhances your knowledge because you're seeing it from different perspectives, and that just broadens it for you. There are definitely broader applications. This is not just hospital administration. You can get into multiple different vistas, and we'll discuss that as we go. And of course, this is business management, not medical management. So you're looking a lot at numbers here. So when you're picking a program, you need to ask yourself, what are your goals? What are you looking for? How do you want to advance your career? What option do you want? Or whether you're not sure of the options either way, then you want to pick a broader one. Time commitment. How much time do you have aside from your work, your family? Can you afford to go part-time to do this? Can you afford to spend this extra time? There's a lot of time involved in doing these programs. Do not underestimate the time commitment here, folks, because that is real. It's not mental issues. If you're a physician, you've done enough memorization, you've done enough education that has been a lot more intense than this. So this is nothing compared to that. Having said that, you probably weren't into a relationship. You probably did not have kids. You probably were a lot younger when you went through medical school, and this certainly adds on very quickly to all of that. And people tend to underestimate the time commitment. That's why I keep going back on it. Financial commitment. Yes, you need to know MBA programs. Pricing ranges anywhere between $30,000 to $120,000, some more, some less. That's the main bell curve here. But you need to be ready to pay that price. And sometimes, although they say it's you make more money after this, not necessarily, right? It can be, you may make lesser. So you got to factor all of that into this. You might also think if you worked extra, you could have made more money and thought of it that way. So look at the financial commitment for sure. Third thing is, can you travel? Not all states have these programs, so you might be considering traveling to a different state. Or is this something that you can even do just online? So you might want to look into those options if traveling is not the best option for you. And then, do you prefer online versus on-site? I personally like the on-site part. Online part, I get lost. I think I lose my sincerity in the online section. I think on-site just makes you focus a lot more. Also, it's very nice to meet people going through the same situation. It is very nice to put a person instead of just a name in front of you. I think it makes a huge difference. It helps you. Make better connections. That's what I felt. But we all are different humans. So you do what you like. Program selection, I mean, you have to look if it is an accredited program by CHME. If you're really super looking into this, okay. Faculty background and their experience. Are they published? Do they have any experience as as administrators or consultants into any healthcare organization? Might want to look at the alumni or the size and the track record of those. Have they been known to hire the new grads for full-time jobs, or do they help you in any way? How well is everyone connected? And that does make a big difference. So the other thing you want to see is what kind of a program. We kind of touched a little bit on that one. Online, on-site, is there a combination of two? Mine was a combination of two, and I think I like that tremendously. You don't have to keep going all the time to class. At the same time, you do go to the class and meet all your peers, and I think I had some of the best years of my life doing this MBA program. We really connected. All of us who were really, we studied like crazy. When we were in medical school, there was no time to do anything, geeks per se, and this was our time when we could have our fun, fully well-established, professionals, and we really behaved like students and had a blast. So think about it that way. And of course, education is so much easier if you're in person. I personally like it. So you can look into, now this part is of course for people that are trying to get into medical college or medical schools. You might want to look into joint programs if you're interested. There's some MD, MBA programs, you can do that. You can try to look into programs that have additional further education, like you can learn Six Sigma and get more credits for it after you're done with the basic MBA. MBA does have that too, but this, if you're interested in getting more information, certain programs offer that, and you can, if you're super aware of what you really want to do, you might want to look into those. So let me give you an example of my program. Mine was an executive healthcare MBA program geared towards healthcare executives. It was a 19-month-long program. We had, like I said earlier, blended on-site and online classes, and the commitment was about 30 hours a week. We had to go to the on-site lectures about 1 to 2 weekends a month, and that was Fridays and Saturdays. Our cohort was really good. We had some chairmans, and on the other hand, we had fresh grads. So it was a very good mix. It was about 36 credits, and most of the education involved. Of course, there were a lot of lectures online as well as on site, and I think most of the learning used to happen through multiple projects and presentations. And of course, we had this research practicum where we had to write a whole huge paper and come up with a plan to change the system in some way and hopefully get published. So ours was a really good one. It was for UPMC that we did, and it was to look for sleep apnea in cardiac patients, and we were saying, and that would result in very good quality of care, as well as saving about $750,000 on an average per week. So it was really a good project. The presentations and projects kind of help you lose your fear of public speaking, and makes you a lot more spontaneous, and it just helps you talk to the crowd a lot better, I think. And also kind of helps a lot in digesting, if you will, all the information that's bombarded at you in such a short time. So, subjects that were offered were statistics, accounting, lots of math, finance, economics, strategy, cost management, supply chain management. There's a lot of math involved. It's very math heavy. So if you're a physician because you don't like math, oh boy, are you in big trouble here. But then there are some really awesome subjects. These were all my favorites that made you think outside the box. The strategy, mission, and values, and evidence-based organizational change, organizational behavior. I simply loved them. And marketing design and analysis. I think those were all my favorites. Very important ones, healthcare law. You want to know law, and they don't teach that to you in medical school at all. Entrepreneurship, I thought that was excellent. It really makes you create your own. The whole program is you create an idea and present to a group of finance professionals and try to sell your idea to them. I loved it. And then comparative health care was the one where you had to compare healthcare in different countries, and it was a great learning process. I think USA has a long way to go, and it has a lot to learn from other countries. And the same works in the other direction too. Other countries can learn certain things from us as well. So, what are the career options available? Of course, well, no-brainer, health, hospital administration. Everyone wants to get into that. That's the top one. But MBA offers a little bit of a broader options. Like I said, you can be an advisor, you can be a consultant, you can be a board member for other healthcare related companies like pharmaceutical equipment, educational, marketing for healthcare products, and you can look into policy analyst or researcher positions. Although I would say if you want to go into policy analysis, I would probably look into public health or something of that nature. And entrepreneurship, right? You want to start your own company, you want to start things on your own, definitely something to look at. How did I apply this to my work? Well, I went into private practice. The reason why I went into private practice is I desperately needed time. My ultimate goal is investment options. I want to invest in other companies, but I want to do my studying of those companies, and in order to do that I need time, and my work just would not permit and it was very busy. It was awesome, but it was really busy where I just could not think outside of my work. It did not give me that option to do so. So I really pre-planned this, switch to private practice, where I can dictate my own terms and my time is something that I can decide how I want to spend it. And I think pretty much all of these subjects were useful for a private practice. So strategy, mission, values, duh. You have to strategize things. Supply chain management, strategic cost management. I think brought my overheads down tremendously. If I tell you my overheads, you're gonna laugh. Insurance and risk management and marketing design and analysis. I mean, come on, insurance. And I think that just opened my eyes big time to the world of insurance companies. I had no idea how CMS works, and now I do. And it's mainly gave me, like I said, the language and tools to talk and to discuss with all vendors and executives that I have to communicate with at this point, and that does help the practice tremendously. Now, who should not do the very important, oh boy, because the highest number of people that have contacted me regarding MBA, and the first line I heard, one of the first lines even I had heard was, I'm burning out. I want to do this. I want to look at other options. Well, let me warn you, if you're burning out or if you're burnt out, this will only make that process go faster. It's not going to ease, nothing's going to ease up on you by doing an MBA. It is, like I said, a ton of time and financial commitment. So you have to be very careful when you choose MBA as an answer to your burnout. It may not work out at all for you. It may actually worsen it. So either plan things in advance. I'm not saying don't do it. I'm just saying you have to really plan plan it out. If burnout is the problem here, cut down on work, be ready to take the huge financial cut, pay cut, and then be ready to manage that in the next couple of years and do it that way. And and if you're successful, awesome. The other, someone is like, I want this degree. Once I get this degree, life is good. No, it doesn't work that way. You cannot rely on just a degree. It is only enough to get you noticed, but you have to take certain other steps. This is just a degree at the end of the day, folks. You have to work towards your career goals, not just by a degree. That's just a little part of it. Participate in talks, participate in projects, participate in meetings, be at the table, do all those things, and that makes, I think, a bigger difference. The MBA gets you through the door. That's pretty much it. If you are some private practice, yes. A lot of private practitioners somehow found interest in MBA, and I can tell you firsthand, definitely not needed, absolutely an overkill. You should not even look into it. If you are running a successful private practice and making good money, don't even bother. Unless you're trying to change your field of work. Don't even bother to even waste 5 minutes on this talk. You just shut the phone down or your video down. You're done. You don't want to hear this. If you're already in hospital administration, if you're already noticed, if you are already famous, if you already have a name, I don't know if this is going to add on a whole lot. Like, I would probably suggest do more projects, do more, you might want to get into some classes for things that you probably are not well aware of. For example, you might want to take a finance class or something. You don't have to do a full MBA. It's just not needed. And it is definitely an overkill. If you're a CEO, if you're a head of the department, if you are a chairman, I mean, honestly, I really look up to all of you, and you've done it. You're there. You don't need this. Just do your classes. If you think, oh yeah, I need to brush up skills on accounting or something, just do that. Don't waste your time. Not needed. Don't waste your money. Not needed. It's an overkill. If you are an entrepreneur, you already own a successful company. Well, I can tell you, we had this guy who came into my class who probably owned like 6 or 7 surgery centers of his own. He sat there for 1 hour and he left because I agree with him. He does not need this. You don't have to. If you got nothing else to do in life and nothing better to do and you want this degree, go for it. But if you've already made it in life, you don't need this. It's an overkill. They try to sell this to you. Don't fall for it. Don't fall for it. Not needed. Caution. Again, I know I said this before, but I can't tell you how important it is to understand the time commitment. Don't underestimate the time. Just don't. Don't underestimate the time. Don't underestimate the effort. I'm not talking about knowledge here. You're intelligent. You know your stuff. You've proven yourself. You've got your gold medals. You've done it. You know you've got the brain for it. We're past that, okay? It's the time and effort, like physical effort here and time. Those are super underestimated. We try to compare it with our MBBS, MD, DO time, and it's bad comparison. Don't compare. You did great. You had that time. You could invest the time. Then it is not going to be possible at this point. It is going to be different, and don't compare. Think of how bad it will be and just add on to it because it is worse than what you think it is, time commitment wise. Do not completely rely on the degree. Like I said, you have to do more. This is not it. You can't just get the degree and say, I'm done. This is fabulous. I got this. It's not going to work. And don't fall for that gimmick. They keep telling you, oh, you're going to get that 46% rise in your income. Not necessarily. You might be making good money to start with, and it may not give you any rise. In fact, sometimes it might actually give you a pay cut because you stopped doing clinical work and went into non-clinical jobs. That actually ends up being pay cut in some situations. So especially for specialists, so you got to be very careful. People that are specialists need to be very careful with that gimmick that programs like to say, oh, we see a big rise in income. Not really. It's not for everyone. It is for some, but not for everyone. Be careful there. Last but not the least, I have to say, I know I'm giving you caution that I'm scaring the death out of you, but the crap out of you. But if I could do it, so could you. It is doable. As a full-time OBGYN, if I could do this as a mom, as a wife, as a woman who's definitely not young anymore, if I could do this, you can too. So as a summary, or let's summarize our points here, you're going to ask yourself a series of questions before you apply for any of these programs. So the questions to ask yourself: do I need a change? What is the change that I am looking for? Will an MBA help me achieve it? Do I have the resources to get me through it? Which program is the right one for me? What else can I do to facilitate my goal as I am going through this program? Don't waste your time. Try to advance your career in that direction. Try to look and see what else you can do. And can I use this as a plan B if that goal is not achieved? Got to think of it that way. Nothing, life comes at you fast and things don't always go as planned. So is there a broader application for this program? So these are some of the things you want to ask yourself before you apply for a healthcare MBA program. Well, I hope this talk was helpful in some way, shape, or form. And yes, I kept using the word physician because I am one, and it just makes it easy for myself to do it. It's more of a reflex level action. But this is also for any healthcare professional who wants to look into all these options. So let me know if this was helpful. Try to post a review down there or a comment down there. Don't they say that for YouTube? And subscribe to my channel. Thanks. Bye.